Thanks, Ben, and thank you very much to the Animal Welfare Foundation for inviting me here this afternoon. I see it's kindly sponsored by CVS. Ben was going to put a sign on the top of my head saying owned by CVS now. However, that's another topic. So the topic I've actually been given today is killing kinder? Has equine geriatric medicine gone too far? So geriatric veterinary medicine in equine practice, for those of you that aren't in equine practice, it is increasing without a doubt. As with the human population, the geriatric horse population is growing. And recent reports show that around about 30% of the UK horse population is greater than, older than, as 15 years and above, and this accounts for around 300,000 horses. And here are my two kids on their geriatric horses and ponies taking part in pony club events. So why is geriatric medicine and surgery growing? It's growing because we're getting better at it. We have more sophisticated veterinary care available, and we're increasing the lifespan of our horses because of that. And together with a relatively recent increased awareness amongst vets and horse owners about geriatric disease, there's more training for vets, specifically on geriatric medicine. Courses are run by Beaver, and there's been much publication to the horse owning public about the existence of geriatric diseases. And maybe it's timely because human geriatric medicine has been a long time recognised as a specialist area, so maybe we need to get our act together and start knowing more about geriatric equine medicine. And certainly through the widespread testing schemes for Cushing's, equine metabolic syndrome, more horses and ponies are now on lifelong prescriptions to help them manage these diseases. Together with, so talking about the growing equine geriatric population, there's also been a change in attitude to horse ownership. You know, gone are the days when horses are only the work animal. There's a much more of a trend towards them being the family pet, as we see here in this picture, and more people are prepared to keep them into retirement and their old age. Here's an example of a horse in our practice, Seamus, dear Seamus, age 36 and owned for 25 years by the same owner. How many other species of pets out there will be owned for 25 years? Not many. So this builds a very strong horse-owner bond, and it makes the whole topic of end-of-life or euthanasia much more difficult. And I put this picture in at the bottom right here. This was Seamus's bedroom. It had his radio, his sweetie jar, his night clothes in his bag. Very much a family pet. With this stronger pet-owner bond, there's much more drive from owners to actually seek and finance veterinary help. And together with the fact that around 58% of veterans are insured for vets' fees, there can be an increased expectation from vets for treatment. But although owners are keen to keep them into their old age and into their retirement, there is actually evidence that the routine preventive health care in that retirement drops off. We're not that good at keeping them as healthy as we should, and there's less veterinary involvement as the horses are taken into retirement. And we as vets need to be aware of that, and we need to address it through owner education and through perhaps offering good healthcare packages for routine preventive care. So are we over-treating geriatric horses, and for whose gain? It is essential that we always have good clinical justification for what we do. We must be transparent. We must maintain our professionalism. And there must always be evidence of response to treatment or recognition of that hopeless prognosis. And in terms of putting into place preventive treatment, there must be a consideration of, is it actually going to benefit the animal, or are they too old to get enough benefit out of that procedure? And in the human field, this is called utility scoring or decision tree, the tree of decision. And we need to keep that in our minds ourselves when we mustn't just get so tunnel visioned on getting into veterinary medicine, the treatment of these older horses. We must decide if it's actually going to benefit them. So for example, advanced dental treatment, is it appropriate in older horses? 95.4% of all 15-year and above horses and ponies in northwest Britain have dental disease. So there's plenty of material out there to do advanced dentistry on, it would seem. A lot of advanced procedures in dentistry require prolonged drip sedation, plus or minus nerve blocks. There's a mouth speculum in place for a long period of time. The head and neck are propped up on headstands. It can be quite stressful for older horses. So are we actually increasing their longevity or compromising their welfare? And being provocative, the age span in that geriatric category runs from 15 to 40. So there's a massive wide age difference, and each individual case has to be considered on its own merit. But we need to keep this kind of thing in perspective. And PPID or Cushing's, are we over-treating? I think we're only just starting with this disease. I think there's been a massive benefit in recent years from the testing schemes that have gone on through Boehringer Ingelheim and through their Talk About Laminitis initiative. And they've revolutionized this early disease detection of this condition in older horses. It's now the 5th most common equine disease diagnosed in the UK, with an increase in prevalence as the age of the horse increases, and with a good response to treatment. So it would all seem that this is a great disease for us to be picking up early and treating. And this is just one example, along with dentistry, of the myriad of geriatric diseases. However, with Cushing's, again, we need to recognise when it's gone over the top, when there's another kind of part of the disease comes into play, and if laminitis becomes a complication, we have to recognise the poor prognostic indicators. As Rowley alluded to earlier, of major concern in older horses is that high prevalence of lameness. 18.6% have been found to be lame at the walk, 50.5% lame at the trot, and 80% hoof abnormalities. But more and more of us, including myself here, coming over a hedge at Osby Horse Trials, want to use our older horses. And 26% of all older horses above 15 years of age are still competing in one or other discipline. It's phenomenal, really. Show jumping, eventing, dressage, driving. 62% are out hacking and pleasure riding, and only 21% of that geriatric population are taking no exercise other than turnout. And I think that's great, really, and it's just that whole debate of where is the balance. In the older sport horse, of that 50.5% geriatric horses that are lame at the trot, as we said earlier, the figures vary slightly, 40% of these are still in work at some level. Many of the elite sport horses don't actually reach the top until they're over 15 because of the years of training it takes to reach that level. So modern equine sports medicine, we need to understand the geriatric management. So are too many older athletic horses being kept going on intra-articular injections of steroids, of IRAP, of hyaluronate? It's much better the horses are kept in work in their older age. It's better for their mobility, for their weight control, as Rowley said. But where is that fine balance? When are we beginning to over-treat? So if we move on and look at the whole concept of euthanasia and how we decide when euthanasia is appropriate, and if we don't recognise euthanasia, are we considered to be over-treating our geriatric horses? There's a massive pressure on the profession to consider quality of life, not prolongation. The horse doesn't understand time trade-off, a term used in human medicine where they will trade some time where it's poor quality of life for an extension of life. They need good quality of life at that time. How can we assess the quality of life? There's no accurate quantitative tool out there yet. There are some guidelines that have been worked on, and perhaps Rowley knows a little more about this for debate later. At present, we have to use our own clinical judgment on our cases that are in front of us, and we need to involve the owner, because the owner is the one that is living with them, spending time with them day in, day out, and they're the ones that hopefully can recognise when there's a drop in quality of life and a need for consideration of euthanasia. An important quality of life markers that are recognised for owners is, does he show interest in his food? Has he lost weight? Has he gained weight? Is he behaving as normal when he goes out into the field? Does he trot off and snake his head as he normally does? Does he get down, roll and get back up? Has the amount of lying down changed? So older arthritic horses, some of them will lie down more because it's more comfortable, and some of them won't like to get down and lie, so the amount of lying down will reduce because they're worried about getting down because they have difficulty getting back up, or the other horses are bullying them when they're lying down on the ground. And I think this last one on the list for me is a very key indicator of quality of life, and that is when they have difficulty getting back up from lying down or when they've been rolling. And I think that's a massive kind of indicator that, and something I use to talk to owners about the quality of life. If they're struggling to get back up, then I think there's worse times to come, and there's going to be perhaps the day when they go out to see their horse and they find that it's been a winter night and the horse hasn't been able to get up all night. Winter time, it's often a good time for vets to sow the seeds of possible consideration of euthanasia. These are the kind of winters we get in Northumberland, proper winters. They may have experienced some sudden weight loss over the winter, or they're struggling to get around in the deep mud and snow. And it is a good time to get owners to think about, are their horses coping with life? They struggled last winter, are they going to get through another one? And often they'll talk about giving them some sunshine on their backs over the summer, and vets can get involved in them making this kind of decision process. Factors that have been shown to influence the owner's decision for euthanasia. Veterinary advice is a major influence. We've got to remember we're in the driving seat on this. Life-threatening problem, long-term unmanageable pain, hopeless prognosis, poor quality of life, and costs of keeping them going. These are important factors. So when we've got these prolonged cases, we need to step back and ask ourselves how many of these factors are applicable to those cases. Delaying euthanasia can compromise welfare. I think this is an important thing to remember. And this can be delayed because of owner resistance, because they're emotionally attached and they don't want to let go. And these difficult horse-owning women that we've talked about can be difficult to persuade otherwise. Vets treating for too long can compromise the welfare by delaying euthanasia. And what I think is really advisable, say to young vets is, set a timeline with the owner. Say, if we've got a difficult case, let's look at this. If this isn't getting any better in a week's time, let's consider whether this is the right thing to do to keep them going. Put a timeline on it and agree it. If necessary, bring in another veterinary, one of your colleagues for another opinion. Trying to get people not to get kind of buried in the whole thing. And some individual vets, and we see it in our practices, have difficulty with the topic of euthanasia. And I think we have to be aware of that and try and explore that with our colleagues if we know that that's the case. It doesn't happen on the NHS, so it's a different concept. We have more and more overseas vets coming into the UK, and they may have cultural differences about euthanasia. And I think that's something, again, I'm not sure how we can tackle that, but there has to be ways of them understanding what's acceptable for welfare in our country. Inexperienced vets and vets that have experienced technique difficulties and therefore put off being involved with equine euthanasia. And we try, and as I do emphasise, it's appropriate cases, we don't go around training them for euthanasia with any cases in our hospital. If we have cases in the clinic, then we know that people are having difficulty with it, then we do use them for kind of retraining mixed practitioners that have little exposure and have had difficulties, and as I say, recent graduates. It's my daughter's pony. It was only posing for a photograph. It is still running around healthily in the field at home, and I don't think I've mentally scarred it, hopefully. My daughter actually took the picture, which was even worse. So we try and advise our owners we encourage them to use the World Horse Welfare just in case owners plan booklets. I don't know if you've seen these. We have them in practice. And we get them to think about a euthanasia plan well in advance so that they're not having to make difficult decisions at an emotional time, and especially they may have in mind when they're calm and collected whether they do want to go to a surgical procedure or whether they don't, and it's important that that decision's made in advance. So to finish off, I've got a few case examples of older horses, and again, just kind of throwing out the idea of, are we doing too much or not? This was a case in our clinic. Actually, Ben Jacklin operated on this. Where's Ben? And this was a 21-year-old horse that was an eventer, went back to surgery twice with a large colon entrapment, and that is this season, this was a year ago, back eventing now this season, that's him on the right. So, you know, should these cases be operated on? I think, again, each individual case consideration about how much, you know, what type of job they're expected to do, and an analysis of the type of condition that we're treating and what is the likelihood that they're going to experience a good quality of life again afterwards. Large wounds, treat or not treat in older horses. This horse was trapped in an electric fence wire overnight. The details of the case are not that important. It's more that whole principle of, you know, how much time each case is going to take, and is there going to be a good outcome, and the type of treatment they need to go through. Is it going to be too hard on these older horses? We had intravenous regional perfusion of antibiotics. They had a needle through and through flush of the joint capsule, which they didn't want to go to theatre. There was a joint sepsis, and a sleeve cast was put, weeks and weeks. But in the end, the joint sepsis was too much, and the horse was actually euthanized. Many insurance companies now will not cover wire wounds on horses, so these kind of things can end up very expensive, and they've started to exclude wire injuries, presumably because they're trying to encourage people to have better types of fencing in their fields. So that's another case. This was one from Patrick Pollock. He was at Glasgow, he's now at Edinburgh Vet School, one of the best vet schools. Tim, you recognise that, won't you? Glasgow's on the other side of the country. So this was a P1 fracture repair, and as Patrick says in his own words, it was on the edge of what is repairable. But this older horse, this was a 17-year-old ex-race horse, and it's now still doing some work. Neoplasia, this is a case in our practice, advanced melanoma in the region of the anus and in the prepuce, the sheath. And this horse has been at the same degree of advancement now for about 6 years. It has difficulty passing feces from time to time, but the only treatment that this horse has received has been the intermittent treatment with cimetidine, and the horse was still hunting last season. So, you know, when are we taking treatment too far if the horses are still enjoying life? And two more cases left. 19-year-old brood mare with ocular squamous cell carcinoma, another one to credit to Patrick Pollock, where the squamous cell carcinoma removed, the eye removed, and this mare went on to breed 3 more healthy foals. And the last one, again, a case in our practice of a 21-year-old pony who had a squamous cell carcinoma of the penis, and he underwent a partial penile amputation, and he enjoyed several more years of pony club life. Top cat. So in summary, points to take out of this: individual vets may have difficulty with euthanasia, and I think it's trying to find out from them, you know, what the difficulties are and whether we can help them with that, because that is going to benefit the welfare of our horses. Protracted cases, suggesting to vets that they take a step back and involve other colleagues. Setting a timeline on cases for improvement with the owner. Appreciating that there's a wide span of age in geriatric classification, and each case has to be considered. We can't have a blanket of older horses shouldn't receive that treatment, because each one needs separate consideration. We are very influential as regards euthanasia, and we need to remember that. We have to be able to understand and work out when it's appropriate, or else we are going to be over-treating and we will be causing poor welfare. Timely euthanasia protects horse welfare, and some acknowledgements. Thank you very much.
Thank you, Lesley. That's a great run through, and I think was thought-provoking. And there's certainly been some thoughts on the old Slido. So I'll start with this one. Is signing horses out of the food chain committing some older horses with low economic value to prolonged suffering when euthanasia cannot otherwise be afforded?
Signing them out of the food chain, sorry?
Does it make people reluctant to put them down because of the costs of euthanasia and disposal?
Yeah, I think that there's a certain element. I mean, if people aren't in equine practice, certainly euthanasia is a costly procedure. I don't know that signing them out is a big issue. I don't think they consider that as being part and parcel of it. I think that people are very happy to sign them out of the food chain, and I think they cross the bridge of euthanasia and costs as a separate issue when it comes up. But for certain, you know, when it comes to the time of euthanasia, I think that the costs are certainly something that they know they have to bear, and it's something that we take great care to explore the cost options with them.
Thank you. Thank you. I mean, it's a big issue, probably less of an issue in the UK, because I know we feel that costs of euthanasia are high. Cost of euthanasia and disposal, if one's using an injection in the UK, is around £500. But compared with continental Europe, this is good. There are methods of disposal in the UK, whereas in many continental countries, there isn't an option outside of a slaughterhouse. Yep. So I think most people plan ahead. It is an issue with certain groups of owners who are reluctant to euthanize, and that's almost a cultural issue as much as a cost issue.
Yeah. And certainly I think it's really important that as vets that we take time to, before euthanasia comes up, if we can, if it's a non-emergency situation, that we actually really explore what the choices of the owner understands, the choices of techniques of euthanasia and the costs that are associated with that, so that they can make an open decision. And I think it's also really important that they understand the techniques as well. That's another thing that's come up in the research, is that they find it easier to deal with euthanasia if they actually understand the details of how it affects their horse when they are euthanized.
I mean, because Sheila Crispin asked, can we always try and ensure quality of death as well as quality of life when euthanasia is envisaged?
I think, Sheila, I think that's something that, you know, that the veterinary profession needs to understand, that we need to make sure that it's done very kindly, that, you know, and in all instances, you know, we in our practice would advise each case is sedated, and often owners will decide to say their goodbyes at the point of sedation, and we give them that choice again in advance. When would you like to say goodbye? Would you like to stay and see the horse euthanized, or would you like to say goodbye at the point of sedation? And often they'll be feeding them tidbits, we'll sedate them, and they will leave at that point with a nice memory of the whole thing. And I do think it's really important, and it's good for our profession and our business if we can make that very palatable to the owners. But very much talking to them in advance before the day of euthanasia, so that they understand exactly what procedure is going to happen.
But Lesley, what percentage of your owners use the vet for euthanasia?
Use the vet for euthanasia? I would say probably a large percentage. I think we will get probably 70% of our owners would use the vet. They put their trust in you because they feel it's going to be done in a humane fashion, in a kind fashion, and that's important to them. I think they like those kind of security of that.
And I'd agree with that. And one of the things we have in our equine practice is we do a lot of dog euthanasia because of the relationship we have with the owners. I'm an expert at dog euthanasia as a result. And it's because of that relationship and the fact that you're prepared to go out and do it as well.
And the other thing that we get quite a lot of in the practice is that they like you to take over the whole organisation of the process. So we have a kind of protocol with right at the interface when they phone and speak to the receptionist, that the receptionists know how to handle that they will get a vet to speak to them, and that we will, on the day, take all of the organisation out of their hands. We ask them their choices, and then we put a kind of time of organisation in place and tell them, you know, how it's going to happen. But they like to not have to do that organisation themselves.
The next question is about euthanasia decision trees, that they're not developed or used, although I think perhaps our discussion tends to tell you that we do use them in equine practice. Perhaps we don't write them down, but they are.
We maybe don't label them as decision trees, but I think we do naturally have those with those quality of life markers, and and also considering the options of treatment, and very much having the the owners on board about what type of job they're expecting to do afterwards, or are they happy to have them as a retired horse in the field? You know, I think exploring the whole process with the owner is important, having them on board.
Who judges too old? Should it not be about quality of life? Treating dental disease is stressful in the short term, but produces in the long term, however long they have left.
Say that again, sorry?
So about dentistry decision making, who judges that they're too old to have preventative health care?
Yeah, I mean, I think it's back to us to make the decision really and decide, what age they have, what condition we're looking at treating, how much involvement is going to be, what type of invasiveness is involved in that procedure, and if it is essential and it's going to make the difference between them being able to eat and not eat, then, again, as part of that decision tree, then you'd need to go ahead with it and make it as kind as you can. But if it was a procedure that was, for example, infundibular caries filling in an older horse that was going to take a long time, is it going to make a radical difference to their quality of life? Do you have different views on that, Ben?
No.
Am I allowed to ask the chair?
Yeah, absolutely. No, I think that's totally the case. I mean, I think it is an issue, preventative dental care, particularly in the profession at the moment, because of the introduction of endodontics in equines, and I certainly don't think we're talking about endodontics in older horses. I think it's extractions.
I think you can be in your 15, 16-year-olds. That's the trouble. That's the range. When you
definition of old age, isn't it? We all have that problem.
Yeah.
Most of your case studies demonstrate successive procedures by the horse being alive and in work. Isn't that a low benchmark for welfare assessment?
Yeah. My husband pointed that out when he saw my toy. He says, "What about the ones that have failed?" But I guess you're trying to put a positive spin on it. But there was the wire wound case there. I think you would hope that you can try and not embark on the ones that are going to have poor outcomes, but inevitably they will happen. So you're suggesting that I'm encouraging more treatment of older horses because there's good outcomes?
Yeah, I mean, another question that was here that's gone was encouraging lame horses to be ridden. Is that a good way forward too?
I think, perhaps Tim will come into this as well, but I think it is a balance between the degree of lameness, it's a balance between the job that they're expected to do, and as Rolly said earlier, your 1 out of 10 hind limb lameness for the leisure horse is really not going to be a welfare issue. I think that if we are using intra-articular medication and use of several grams of butadiene to keep a horse sound enough to do an athletic job, then you begin to question whether that is ethically the right thing to do. But equally, I think it's sometimes better for horses to remain in work and have a job to do and have some degree of exercise rather than be out in the field as retired horses, getting fat and perhaps getting laminitis and not being used, not being cared for. So it is a little bit of a juggling act, I think.
The next question is anonymous. I think there have been some questions from the audience as well. So please show your hands again in a second. But is corporate ownership, I think we can guess who's asked this question. Is corporate...
This is reserved
This might be our sponsor.
You've got to come to Beaver Congress to get these answers.
Is corporate ownership one solution to vets feeling commercial pressures on their own business and feeling coerced into unethical practices?
I would say that probably corporate ownership is less likely to drive you to that. I think that so the story behind this is that 2 years ago we sold our practice to CVS, so we are now a corporate practice. And I think for those, so I've made the transition from being a privately owned practice into a corporate practice, and I don't think it changes your mindset one bit. I think you remain with the same ethics and the same drive, and I think you're doing it for your clients and your patients' benefit, and patients primarily. And I don't think you literally don't take any influence from either being privately owned or corporately owned. I think that's is that a fair answer, Ben?
Yeah.
They also get a shed load of work out of me, CVS. That's another thing that doesn't change when you become corporate.
Should horse welfare not be judged on the individual animal, not what humans want the horse to do? Getting a horse back to work shouldn't be a welfare benchmark.
Yeah, I understand what you're saying, is that that we should be considering horse welfare separate to a job that they need to get back to. I think there is a lot of pressure from the competing horse owners that they are put back into work, and I think it's, we have to take some responsibility if we feel that that is not appropriate for individual cases, and that's probably something that the more sport horse work you do, and probably the more experience you get, that you're able to draw the line with owners. And I think that you'd be surprised how many of the owners of good athletic horses are actually, they don't want to jeopardize their good horses, so they are prepared to take a step back if a horse needs to. I think we have this perception that they're all very hard on their horses, but if they've got good horses, they will respect their welfare needs.
Thank you, Lesley. And the final question from Dick Sibley. The resource and financial cost of maintaining an old useless animal is high and sometimes unaffordable. Is it morally right? I've lost that question, chaps. I haven't finished reading it. Is that morally right? Does that make sense?
So is it morally right that horses...
Do you remember what that question said?
So what are you asking, Dick? Where are you?
Can I have that question back, please, Dick?
Is it morally right, basically, to keep taking money from people who can't afford it?
Dick, I think it's the owner's decision to tell us when they want to stop. I think that's that's their prerogative, and I think if they still feel emotionally attached to their horse and they can source the money to keep caring for them, then as long as we're not we're not putting unnecessary procedures in place that they don't want to afford, and as long as that horse's welfare is still good, then I think it's their decision to be able to keep them going into their old age. I think so. You're asking if it's morally right for us to be charging them a fee for our time. Well, I think the discussion has to be between you and the owner as to what they wish to spend, and also whether that's going to leave that horse with the correct care that it needs. So I think it's the owner's decision to afford or not afford, really.
It's very difficult, isn't it? Because having done a lot of European politics recently, where attitudes to euthanasia are very different, I almost wonder whether we're a bit too trigger happy in the UK, and our moral responsibility is to the animal and the animal's welfare and its veterinary health care as a result. And there is a little bit of a culture of it's broken, let's put it down and get a new one. And that worries me somewhat.
I think, sorry. There's a question here.
Yeah, go on. Which might be a mic. Yeah, here we go.
Adele Waters, I'm the new editor for Vet Record. Thank you very much, it's very interesting. I guess as a non-vet, I'm quite surprised that there aren't any written published guidelines to guide a vet, a clear decision-making tree about when it is appropriate to euthanize a horse. And so 2 questions related to that. One is, why do you think that is the case? And secondly, would you like to write it up for Vet Record? So that we do have some written guidelines.
I guess Rolly might be able to contribute to this one. I guess the reason we haven't got the written guidelines is because it's, there is some work being done on it, but it's presumably because we're dealing with animals and it's hard to get, you need feedback from the owners. You need to be able to. So it's just a work in process. I just don't think the research work has been done on it.
Yeah, I think it's very difficult because ultimately horses are classified as property, and it's up to, if the owner wants to destroy their property, they can destroy their property as long as it's not suffering in the process. So every decision is different, and I would be it's a very grey area, and there's so many factors. I think guidelines would be confusing.
I think medical guidelines will come eventually. I think they're in the process.
I think you can take reflection reflection from the fact that they haven't been produced is because it's very
Good
difficult to
enough.
produce them, and situations are so context specific. But that doesn't mean that there shouldn't. Some principles are there, but because you haven't got quality of life assessments sorted in the animal world, that makes it, the benchmarking very difficult.
But in the absence of anything that's written down, then it is up to each individual vet to make a very difficult ethical decision. And I thought, actually, your presentation was interesting because it set out, actually, lots of the criteria, and even having that would be a useful guide, I would have thought.
Do you want me to write an article then?
Yeah, show the video.
We're on.
Thank you very much, Lesley. We ought to move on in the sake of time, so thank you very much.